So hello, my name is Aleena. I am a second-year family medicine resident through the University of Ottawa in the Rural program of Winchester. I grew up in a small town of Rockton, Ontario, which is kind of near Guelph area, and I did my medical school training in Ottawa. Growing up in a small town, I always knew that I wanted to ultimately practice medicine rurally. However, once I was actually in medical school and actually had the opportunity to go to different rural areas, I really fell in love with rural medicine. And I think the biggest part of it was really just the diversity. I never really appreciated that until I started to actually go and do that work. So although I'm in a family medicine program, I would say that I do a little bit of everything all the time, and it's just very stimulating and very exciting all the time. So that is why I chose rural medicine. So right now we actually have 7 residents, which is the largest that we have ever had at the Winchester site. And I think that's very exciting. We are growing. Typically we take about 2 to 3 residents per year. But lately we have been able to take 3 residents each year. So we have 3 first-year residents as well as 3 second-year residents, 4 because 1 was on mat leave. So there are so many things I love about my residency program, but if I really had to pick one, I think I would say just the collegiality of the program itself. Everybody that I work with is fantastic. The nurses are wonderful, the doctors are wonderful, the other residents are wonderful, and it's just a very supportive environment. So I am really able to thrive because everybody kind of has your back, and I think that's certainly a huge pro. So I would say that I'm very much a hospital medicine sort of person. I do like family clinic, but my favorite thing to do is hospitalist work. I really like inpatient medicine. People come in and they're usually pretty sick, and usually there's a way that you can fix them. So it's a little bit more acute, but you also are able to follow that patient over their time in hospital, which allows for a bit of continuity as well. So it's really kind of the best of both worlds. I would say that my advocacy role really comes down to resident education. That's kind of what my passion has been. And so because of that, a lot of my time has been spent trying to make our program better and a little bit stronger for residents, and just tailor that educational experience to the needs of the residents as well. So that's kind of been my project and my kind of passion outside of the clinical setting. When I'm not at work, probably my favorite thing to do is just get outside into the forest. I love going on hikes. I love spending time outdoors. And I also have a pretty awesome cat who comes on all of these outdoor adventures with me. So I would say that my outside of work life is pretty awesome. Just enjoying the world around me and really taking in nature and resetting before the busy work weeks start back up again. After I finish residency, there's honestly so many opportunities, but the goal for me is really to work in a more northern sort of community. I love the cottage life. I just think it's really nice. I would love to live on a lake and just practice in a smaller community where I can still kind of be a jack of all trades, with a particular focus on hospital medicine and emerge, but also probably a small family clinic. For medical students interested in rural medicine, I think that there are really two pretty important things. So first of all is exposure. I think it's really important that you take the chance to get into a smaller community and really try out rural medicine so that you know it's for you. Some people get out there and they realize that it's not really something they want to do, whether it's location or just the style of practice. So having that kind of exposure from the get-go, I think, is really important. And the second thing would be, especially when applying to residency, because those programs tend to be smaller, it's really important to make yourself known to the people in that program, because I think that kind of personal connection has a lot of weight to it when it comes to the matching process. So those would be the two tips that I would give to medical students.